I'm going to be doing my skull trigger. So first we're going to be looking at the console. So I have the routine skull kind of up here in the menu, and we can select the PA or the tones or the lateral, etc. So we have the wall bucky selected, and there's a grid in there. We also can play with the KVP, but we'll keep that at 85 KVP, and we can also play with the mass. So we'll be setting our techniques before getting the patient into position for each one. All right, that's about it. So then we'll come on over here. And we just need to detent the tube. So I'll bring it here. There we go, detented, and it's at 40 inches away from the bucky. And then that's all set to go. So 40 inches between the tube and the bucky. We have a DR plate in here, so we don't need to worry about taking the IRs out, in and out, but you can typically use about an 8x10 or a 10x12. In this case, I'll probably start off with a 10x12 and then collimate in if I need to, since we're doing the cranium for this study. And let's get started. Sarah? Hi, I'm Sky. I'm from X-Ray. I'll be taking your X-rays today. Hello. Can I get your full name?
Sarah Smith.
And what's your birthday?
October 2nd, 1990.
Okay. Is there a chance that you could be pregnant?
Nope.
All right. And are you wearing any jewelry or any earrings or anything in your mouth?
Nope.
Nothing at all? Nope. Okay. And what brings you in today?
I got hit in the head with a baseball.
Ooh, that doesn't sound good.
No.
All right. Well, come on over here. Is there a side that hurts more than the other?
My right side.
Your right side? All right. Okay, so to get started, we're going to be doing the PA axial projection of the cranium. We're doing the Caldwell method for this, so there's going to be a 15-degree caudal tube angle. And first, let's go ahead and get the patient positioned here. So go ahead and face the bucky, nice and close. And then just tilt your head down so that your forehead and your nose touch the bucky. And always remember to have the bucky wiped down for the patient so that when they come in for their exam, it's a nice clean environment for them, because they're going to be having their face on the machine. So with her head tilted down a little bit, her OML is going to be perpendicular to the IR. And it's going to be exiting the nason. So I'm just going to bring this up a little bit to start off with. There. Okay. And so at this point, we'll put the shield behind her. And I need to put the tube angle on the tube. So we'll go to 15 degrees. We're going to line the tube up with the bucky.
Right there.
Just make sure that the central ray is exiting the nason, and you can see that from the bucky, and then following the crosshairs straight to that nason hole area. And make sure that you go ahead and mark which side is the patient's. So this is going to be her left side here. We'll just put that there. And so for all of these projections, the patient's just going to suspend their breath, and then we'll take the image. All right, and so for the technique for this Caldwell method, I would say 85 kVp at about 7 or 7.5 mass, so 7.5 mass. And we're ready to shoot. All right, Sarah, just hold your breath. Ding! X-ray. Okay. So the next projection that we're going to be doing is the lateral projection. And before you do anything, take the tube off of take the angle off of the tube. You can't do it the other way around. Okay, back to a horizontal tube. We'll just bring that down for now. We can have it back on tracking at this point. All right, so since we are looking at Sarah's right side, because that's where she's feeling the most pain, I'm just going to have her be in an RAO position so that we can decrease the OID instead of having it in a perpendicular lateral projection. It's going to be kind of more, her body will be obliqued, but her head will be in a true lateral position. So go ahead and just have your head face me. Go ahead and put it next to the board there. And so for this projection, the central ray is going to be entering 2 inches superior to the EAM. So just right above the ear. So I collimated in a little bit for her, but I'm just going to make sure that everything's lined up perfectly. So it's going to be the mid-coronal plane. And yeah, just entering right above the ear there, 2 inches superior to the EAM. Make sure that the interpupillary line is perpendicular to the IR. And that just helps to not have tilt in the skull. Okay, so make sure that your marker marks the correct side. So since her right side is closest to the IR, I'm going to switch out my left marker and put my right marker on. Okay, and we are ready to go. Make sure that she is shielded. And the technique for this one would be 85 kVp at about 3.2 mass. All right, so Sarah, go ahead and hold your breath. X-ray, ding. Okay, so the next projection that we'll be doing is the AP axial projection. It's the Town method. And so for this one, we're going to have the tube angle at a 30-degree caudal angle. So let's go ahead and just do that right now. Okay, so I'm going to have my patient turn around and face the tube with their back against the bucky. And for this one, the central ray is going to enter 2.5 inches superior to the glabella. So it'll be kind of like mid-forehead or so, and passes at the level of the EAM. That's how you know that you'll be in the correct spot. And so for positioning, I'm going to have her OML perpendicular to the bucky. So I'm going to tilt your head down just a little bit. A little bit more right there. Perfect. And go ahead and close your eyes. It might be a little bit bright. Okay. And make sure that her mid-sagittal plane is perpendicular to the bucky as well, and that the central ray is entering that MSP. Perfect. Okay, so I'm just going to take this shield away. This is a little bit of a burden, but I'll be putting the lap shield on her. Okay, and so you can see that the crosshairs are kind of coming and they're crossing over the EAM, but they are centered to the 2.5 inches superior to the glabella. So for a technique for this projection, I would say 85 at about 10 mass, and that's it. Okay. So Sarah, go ahead and hold your breath. X-ray, ding. All right. So the last projection that we'll be doing is the submento vertical projection. This is the Schuler method, and we're going to first take the tube angle off of our tube. So it's a nice horizontal tube. And to position the patient, we're going to be bringing her head back pretty far, hyperextending her neck, and the vertex of her head will basically be touching the IR. You can kind of scoot the what is this thing called? A stool. You can scoot the stool forward a little bit, or you can have, if they're standing, they can kind of step forward a little bit so that they can lean back a little bit better, more comfortable. So you want the IOML to be perpendicular, or no, not perpendicular, but parallel with the IR. So it'll be running parallel to each other. So go ahead and dip your head back all the way, good. You can support their head if you need to adjust the bucky. Make sure you collimate. And make sure that the mid-sagittal plane is perpendicular with the IR and that the central ray is entering the MSP. The central ray is also going to be entering in the throat between the two angles of the mandible at a point kind of like 3/4 of an inch anterior to the level of the EAM. So that's a little bit above where the ear hole is, the external auditory meatus. So just a little bit above that. And that looks pretty good right now, so I'm just going to drop it down a little bit more. Right there. Perfect. Okay, so she's shielded. I have my marker on there. And we are ready to take the image. We also have the horizontal beam. So the technique for this projection would probably be about 85 kbp at 14 mass. Okay, so Sarah, go ahead and just hold your breath. X-ray, ding. Okay, so Sarah, you are all done. Thank you so much for being patient with me. Go ahead and get dressed, and just make sure that you wipe down the board after every patient so it's nice and clean for them. All right, we're done. Woohoo! Yay!
The first image we're going to be looking at is the PA axial projection, known as the Caldwell method, and this one has a 15-degree caudal tube angle on it, which makes the petrous ridges lie in the lower third of the orbits versus the regular PA projection, which would have the petrous ridges filling the orbits. So you want to make sure you have the entire cranium without rotation or tilt in this. And the way that you can find out if you've positioned correctly is by looking at the petrous ridges, make sure they're symmetric. Also, you would have equal distances from the lateral borders of the skull to the lateral borders of the orbits on both of the sides. Some of the anatomy that you can see in this projection is the frontal sinus and the crista galli kind of up at the top between the orbits. You can also see the superior orbital margin, that's the little kind of whiter part above the eyes. You can see the ethmoidal sinuses, the darker area on the side of the nose, and also the petrous ridge, obviously, in the lower third of the orbits, and the inferior orbital margin and the superior orbital margin, which would be where the eyes are. The next image that we'll be looking at now is the lateral projection of the cranium. And in this image, you can see the sella turcica, the anterior clinoid processes, dorsum sella, and posterior clinoid processes. And you want to make sure that there's no rotation or tilt. And you can check that by making sure the orbital roofs and the greater wings of the sphenoid are superimposed. You can look at the bottom of the image at the mastoid regions and the TMJs in the mandible, and those should be superimposed as well. And the sella turcica should be in profile. The next image we'll be looking at is the apiaxial projection, in this case the Town method, which has a 30 to 37 degree caudal angle, and it would be entering 2.5 inches above the glabella at the level of the EAM. And so for this one, the most important thing to look for is the dorsum sellae and posterior clinoid processes visible within the foramen magnum. And you would also want to make sure that there's no rotation or tilt. And you can tell if you've positioned correctly, if there's equal distances between the lateral borders of the skull and the lateral margins of the foramen magnum on both sides. The petrous pyramids would also be symmetric as well. The last image we'll be looking at is the submento vertical projection. It's also known as the Schuler method. And with this one, the patient's head is going to be tilted backwards, so their neck will be hyperextended. And so the IOML is going to be parallel to the IR. And you can tell if you've positioned correctly if the mental protuberance is superimposed over the anterior frontal bone. Also, you can tell if the mandibular condyles are anterior to the petrossae, then you've also positioned properly. And just like the other ones, make sure that you have the entire cranium and be sure to include it without tilt. You can tell if you've positioned correctly this way by having equal distances from the lateral borders of the skull to the mandibular condyles on both sides. All right, everyone, thank you so much for watching my trigger on positioning for the cranium portion of the skull. That's the end.